Wow. Well, Shavell is joining us now via Zoom. Shavell, welcome to the show. I want to jump right in with you if I could.
Thank you.
You know, we talk about your inflated EGFR number. You say that it actually hurt you financially having that inflated number. How is that?
If you are marked at maybe acute, then you don't get the assistance that you may need to help pay for dialysis. But they're telling you that you do need dialysis. And dialysis is very expensive. Even if you have your own private insurance, there's still going to be a lump sum amount that will not be covered.
Yes. So if you are in acute kidney failure versus total kidney failure, the insurance companies are going to pay a different percentage based what they're seeing as the severity of the problem. They look at acute kidney failure as less severe, so they pay less. They look at total kidney failure as more severe, they pay all of it. And if you have an EGFR number that is inflated, that is not correct, and is giving you the wrong stage, then in the end, it could hurt you financially.
Correct.
And so how are you feeling now?
I feel really good.
And Dr. Eneanya, I got to ask you, what actually is the call to action? What needs to be done?
First is we need to have a call to the scientific community to really conduct responsible research that doesn't have unintended complications or unintended consequences down the line of actually hurting patients, because we all want to do what's best for our patients with kidney disease. And then next, what I would say is that we need new tests that are the same across racial groups. In the meantime, what I would suggest is knowledge is power. And so for Black patients in particular that have kidney disease or family members of patients that have kidney disease, really you should be talking to your doctors about your kidney function and how is it being determined. You know, are they using an EGFR number? Is race being used? And if there's any question about whether you feel that you're getting proper care, I would absolutely ask for a referral to see a kidney specialist. That's something that we're well versed in. We know different tests that can be used, urinary test, urine test. There's another test called cystatin C, which is very similar to creatinine that we can check that does not have racial differences. And I think, you know, you could really be proactive about how you take care of yourself. We know that diabetes and high blood pressure are the number 1 and 2 causes of kidney disease in the United States. And kidney disease doesn't really have any symptoms. And so you really should be asking your doctor, especially if you have diabetes or high blood pressure, well, how do my kidneys look? And I think the conversation starts there to be an advocate for yourself.
Well, I just want to thank you all for joining us today. I want to reassert that we are not saying that doctors are purposely not trying to give African Americans transplants or treat them, or insurance companies are not trying to pay their fair share. We're not saying that at all. What we're saying is that sometimes in medicine, studies are old. And if different populations are not included in the studies, this goes for women also, by the way, having more women in studies, then we don't have the proper data to make statements about the entire community. And so hopefully this will get conversation going, saying, hey guys, let's take a look at this and fix this, because all of us want people to be treated equally and to have the best shot at life. So Shavell, Nicole, Dr. Eneanya, thank you for joining us today.
Thank you for having me.
Thank you so much for having us.
Thank you.
Okay. And of course, for more information on kidney disease, just visit our website. You know it, thedoctorstv.com.